This is PUC Nurse. Let's answer a CCRN question. Question. A patient with a chest tube becomes tachypnic, hypoxic, and has absent breath sounds on the affected side. What is the priority action? The answers are A. Increase oxygen to 100%. B. Notify the provider immediately. C. Check the chest tube for kinks or occlusions. And D. Clamp the chest tube. And the answer is C. Check the chest tube for kinks or occlusions. Let's look at the rationales. The correct answer C. Check the chest tube for kinks or occlusion is correct due to the following. A sudden deterioration with absent breath sounds suggests a tension pneumothorax, possibly from an occluded tube. Checking for kinks or obstructions is the priority. Now, even though this is a priority because when we take our tests and exams, the question always wants us to know at least one intervention that we can do before we contact the physician. So in this question, you would quickly check the tubing for kinks and occlusions and then quickly call for a physician if you notice no kinks, or maybe call a rapid response or early response team, depending on what your institution utilizes, because the patient could deteriorate quickly if it's a tension pneumothorax. It's a life-threatening situation. So whatever actions you take, it needs to be quick, and any person, such as a physician, a surgeon, whoever who can actually take rapid action to remedy this situation should be called in as quickly as possible. So the answer C is correct. Um, Check the chest tube for kinks and occlusions. For this question, in this scenario, what should you do first? Check the chest tube for kinks or occlusions. The answer A, increase oxygen to 100%, is incorrect because remember the question is asking what is the first thing you should do. It doesn't mean that increasing oxygen to 100% is wrong. But for this question, the first thing you want to do is check the tubing for kinks so that maybe you could relieve the tension in the patient's chest, and then call the doctor, increase the oxygen to 100%, and all of the other things that would benefit the patient. So for this question, A, increase the oxygen to 100% is incorrect because increasing oxygen is supportive but does not correct the underlying issue. B, notify the provider. For this question is also not correct. The provider is necessary but should not delay. Notifying the provider is necessary but should not delay immediate troubleshooting. So this answer is saying, yes, we can contact the provider, but what can we immediately do to relieve the situation? If we can do something to relieve the situation before notifying the provider, checking the tubing for kinks or occlusions. If you find any, relieve it if possible, and then notify the provider, and then increase oxygen to 100%. The answer D, clamp the chest tube, is also incorrect. Clamping the chest tube will worsen the tension pneumothorax. Remember, the answer to this question is checking for kinks or occlusions and undoing those kinks or occlusions. So, and those kinks or occlusions are the cause of the tension pneumothorax. So this answer is very, very wrong, obviously, clamping the chest tube, because it makes the tension pneumothorax worse. Thanks for watching. Please like, share, and subscribe, and I will see you in the next video.